First of all, see if this works. Yes, there we go. Welcome to everyone on the webinar. This is the first of the SAFMA topical webinars that we're holding. This has been generated by a need, we think, to share, discuss what's happening with the facilities management as a result of COVID-19. I don't think anyone is unaffected, and what SAFMA has looked at doing is to share with everybody what the thinking is from local and from international. And this is not a one-way traffic, this is a two-way traffic. So no one has the answers, and we will get to the answers with the input of everybody. So this is a joint initiative where everyone is welcome, and also we would like you to all be involved. So what we've set up is a series of webinars. We've got local and international speakers. We've got local speakers to start with, but as we go down the webinars, we've got international speakers that are coming in, and we'll go through the webinars shortly. As we say, we welcome inputs, questions, and your views. So what the structure is, we've got 4 speakers. We've got today, we've got 10 minutes for questions. We think we will get more questions than we can answer. We've got a repeat of this webinar because of the response. So next week, we've got a repeat of this webinar. And then the third webinar, we've got a speaker for 30 minutes, and then we're going to answer the questions that we have collated. So we're responding to everyone. We don't answer all your questions in this one, and we don't answer it next one. We will be answering them in the third one, and then this webinar and the others will be up on our website and sharing it on social media. So this webinar was a sellout, took 22 hours to sell out, and as a result of that, we're running another one next week. So in this, the first of what we call the topical webinars, we've got 4 speakers. So Andrew Mason will be talking on staff and visitors, David Pierre-Eugene on workplace planning, Stephen Malloy on soft facilities management, and Cliff Hocking on hard facilities management. And then we'll have a question and answer session. So the program we've set up in response to in the response that we've received from everyone is this is the first one. With the response we got, we immediately set up the second one, which we're looking at doing next week. And then the third one we're doing on World FM Day will be hosted by Andrew Mason. We've got a guest speaker, Andre Klopper and others, and that's basically on World FM Day. So we've shuffled the dates around for that. The fourth webinar is Paul McChrystal, a previous chair of SAFMA, who's currently in Dubai, and he's going to give us an international perspective on what's going on. And we're then going to look for, as I say, the answers to the questions of the first 2 webinars. So this is not just local, what's going on here, we've got an international flavor. Webinar 5, fire and safety, and then we picked up on workspace fogging, and we're looking to get a guest speaker on there. We've got our ideas, we just haven't closed that one out yet, but we're looking for another guest speaker, probably looking for an international guest speaker. And then on webinar number 6, we're starting then a fortnightly sessions, and we're already looking at number 6. And we'll pick up topical webinars from there based on topics that will arise out of the questions and issues that come out of what's going on. Response to you, our webinar attendees, and also what's going on in the market. I mean, the COVID-19 impact and what's happening with the market, what's happening with schools, is very dynamic. And anything we've got today at this moment is probably out of date after lunch. So that is a quick introduction on where we are. It is a program that we've set up. It's in response to the market, in response to our membership, which we like to do, be responsive. And this is about sharing. This is not a one-way traffic at all, and no one's got the right answer. So with that, and slightly ahead of schedule, I had 10 minutes. I've only used 6. And looking down is me looking down at my watch. So the first speaker is Andrew. He's got 10 minutes, and he's going to talk about the impact of staff and visitors. Andrew, that's over to you.
Thanks, John. Hopefully everybody can hear me. He said scrabbling for his earphones because it's probably better quality. So, as an introduction, so many facility managers have been working during this period of lockdown in supporting essential services. But those that have been in lockdown will now have to be the first responders in ensuring that workers feel secure going back to work when our buildings fully reopen. We need to understand that COVID-19 cases are still on the rise in South Africa. So coming out of lockdown is going to be hugely risky for us. But obviously the government cannot wait to flatten the curve as they are in other countries because of our economic and social circumstances. So it's very, very certain, I think, that we're going to get a second wave of the virus. And so we're going to need to be very adaptive. There's this thing called adaptive triggering, and that's what the 5 levels of lockdown are there to achieve. So obviously different facilities types will need different solutions, but we're going to cover some stuff here today, and you'll need to adapt those to your circumstances. So what are the legislative considerations? Well, we basically have 3. First off, right at the top of the tree is the National Command Council, who have their powers under the Disaster Management Act of 2002. And many of you will have seen the latest risk-adjusted strategy regulations, which were published on the 29th of April, that was yesterday. And many parts of the country are going to go into National Command Council that we have mandatory wearing of face masks in public places, and employers must provide face masks for all public-facing employees. Every business must determine a floor area to be able to assign in writing and prominently display, which is quite important, the compliance employee whose duty it is to ensure that the following is adhered to. We need to calculate the number of, or maximum number of customers and employees that can be inside the premises at any one time. We need to take steps to ensure and maintain, and importantly, control the distance of 1.5 meters from each other, or the social distancing, what we've come to know as social distancing. We need to enable employees to work from home. We need to provide adequate space. Obviously, there needs to be restrictions on face-to-face meetings. The provision of hand sanitizers for use by all at the entrances to our workplaces. But importantly, there needs to be special measures for employees with known, and that means known and disclosed, health issues or comorbidities, and also special measures for employees over the age of 60 who are obviously in high-risk categories. Under the National Command Council, we then refer back to the Department of Employment and Labour, which have produced a workplace advisory for COVID-19. Top of the list there is individual businesses, all workplaces must have a COVID-19 risk assessment and plans in place. On top of that, they must, they say, conduct worker education on COVID-19 and protection measures. And they list the following: identification and protection of vulnerable employees. We've just mentioned comorbidities and those old age pensioners, almost me. They must talk to safe transport of employees, the screening of employees and visitors on entering the workplace, and we'll come on to that in a little bit later. Prevention of viral spread in the workplace, cleaning of surfaces of shared equipment, management of sick employees, the provision of good ventilation, and the implementation of workplace controls, which is very important as far as your risk assessment goes. And the third legislative thing we need to take into consideration is the POPI Act, the Protection of Personal Information Act. Couple of quick things on there. When we take temperatures of people coming into the workplace, there is no consent required to take the temperature. And what that means is if somebody refuses to give you a temperature reading, you can refuse them entry to the workplace. That is, you are legally entitled to do that. Okay. If you do take temperatures, you need to take details of the person for tracking and tracing purposes. Okay. Then we come on to the next item, which is the return to work strategy. We need a return to work strategy, which starts obviously with the risk assessment. You need to start planning to work these guidelines and talk to your key stakeholders. It's suggested that you set up a committee to ensure that individuals are involved. You need, as we've said previously, to assess the max capacity of people in the workplace. You need to identify the key employees who need to be in the office more than others, such as members of the facilities teams. And you need to consider staggering the team's return to the office. Now, that's not probably within your remit, but you need to understand who is coming into the office and who isn't, whether it's on a rotational basis, and you need to understand the cleaning regimes around that. But we'll come on to cleaning regimes. One of my co-directors will come on to cleaning regimes. You need to maintain a list of members in each rota group, obviously for tracking purposes should infection break out. And obviously, very importantly, you need to understand that this is likely to cause budget increases in your situation. So, updating the workplace risk assessment, very, very important. If you don't have one, you're going to have to create one. If you've got one, you're going to need to update it based on the latest information. It is obviously not possible to eliminate COVID-19 in the workplace. And so we need to use the hierarchy of controls method, which should be in your risk assessment. That is first top of the list, engineering controls, then administrative controls, safe work practices, and last but by no means least, PPE. But please be sure that PPE is a last resort and has to have clear guidance for correct use. It is not the most effective means of barrier against COVID. Okay. So, how can facility managers take practical steps to minimize exposure for staff and visitors? Well, firstly, you need to update your standard operating processes and procedures. Those procedures need to be placed in visible places around the workplace so everybody can read it, whether those are documents, posters, online, whatever it might be. You need to publish and communicate revised floor plans and work settings, and we'll come on to what that means in a minute, and provide for signposting on one-way traffic patterns in the workplace, which is suggested. We need to identify potentially high-risk areas, such as lifts, water coolers, pause areas, meeting rooms, restaurants, corridors, smoking areas, and bathrooms, and we need to reduce physical contact in those areas. It's advisable to isolate workers who can carry out their tasks on their own and put them in either spare meeting rooms or other areas. It's advisable to set mealtime breaks and reduce the number of people sharing cafeterias if, in fact, hot food is allowed to be served, and we're not entirely sure whether that's going to be the case or not. All staff, of course, must monitor their health and self-quarantine for 14 days if they show symptoms. Those that do show symptoms in the workplace may be required to go home and isolate and seek medical help. Okay, PPE is not going to be sufficient to retain them within the workplace. Employees should be encouraged to carry hand sanitizers and, interestingly, deliveries outside the premises, please, and obviously sanitize anything that comes into the workplace. So how do we adapt the workplace to accommodate social distancing? So we carry out changes to the layout of the workplace before the workers return. Very important. We can't do it once the workers return and get them to move desks around, okay? That needs to be done beforehand. Pre-planned seating arrangements with key teams and stakeholders, and you need to set up 2 or 3 desk separation between individuals, bearing in mind the social distancing of 1.5 to 2 meters. It's interesting, we say 1.5 meters in South Africa, and the rest of the world is saying 2 meters. You need, where that's not possible, you need to be able to place an impervious barrier between the workers and avoid back-to-back seating arrangements. Okay. You need to identify suitable workspaces in which you can use and quarantine workers that become sick in the workplace. Okay. Cleaning protocols, obviously, but we'll come on to that. I know that somebody else is covering that subject. Information and signage in the workplace. You need to place posters at the entrances and exits to the workplace to inform people of staying home when sick, coughing and sneezing etiquettes, and hand hygiene. Obviously, social distance guidance in the office where accessible through signage, whether that's on the floor or on the walls, and online and printed collateral as well. You need to provide information to everybody in the workplace on who will be working in the workplace and provide guidance on the new office layout. Signage is a big issue. You need to be able to provide instructions to people on what to do on entry and exit the building, bearing in mind that not everybody will necessarily be familiar and the workplace is going to be altered. Then we need to talk about transport, not directly to and from the workplace. You need to request workers to use individual rather than collective transport, and I know that is not always possible in South Africa. But having said that, the reduced people in the workplace will mean that car parking is available. So provide that if you can. Provide a place for storing bikes, and ensure, if you can, that workers walk to work, not walkers work to work. Walkers work to work if they possibly can. In terms of meetings, obviously we need to discourage face-to-face meetings, but if they are necessary, then you need to check the limitations on the size of the or remove seats so that participants maintain social distances. Open doors and windows to increase ventilation, and again, most importantly, retain the names and contact
Have we lost
details.
it?
Have you lost me? You got me?
You're back.
Okay, thank you. Retain the names and contact details of participants at the meeting, if at all possible, for tracing and tracking purposes. Visitors, you need to limit the physical interaction between and with customers where at all possible, and disclosure of recent travel history when they enter the premises is important. And as I mentioned earlier, temperature checks. Temperature checks need to be non-invasive. The use of laser temperature screeners, which you've seen, the in-the-ear type temperature is not recommended. But if that's all of you've got, then that's what you must use.
Okay, 1 minute.
Again, you need to keep the data.
1 minute then.
Go. Okay, good.
Okay.
I'll be there. If any of these measures are not appropriate or cannot be done, then you need to be aware that, as a last resort, it may be necessary to close those operations or close your operations. Okay, so be very, very aware. Communication is the last one, as the second to last one. In times of crisis, you cannot over-communicate. Okay, you need to manage expectations. You need to provide regular updates, involve leadership, and all forms of communication. Communicate. You need to be able to provide feedback. Employees need to know that they are going to be safe. Okay, and the last item, plan and learn for the future. It's important to draw up and update your crisis contingency plans for shutdown and startup events, which are likely to happen if we get a second or third or fourth wave. In the UK, they are predicting up to 6 waves over the next year and a half. Okay, what that means from a planning perspective is a crisis plan, a disaster recovery plan, and a business continuity plan. Okay, that's my 10 minutes up. Thank you, everybody, and we'll take questions at the end. Over back to you, John.
Okay, thanks very much, Andrew. That's great, thank you. So the next speaker on workspace planning, building on what Andrew said, David, that's you. David,
thank you, John.
PG.
Thank you, John, and thank you, Andrew. You gave us a great introduction there in terms of workspace planning as well. So, but maybe just to start off with spatial separation, social distancing, and also just to put it in context from a corporate real estate strategy. I'm going to give you a quote from Winston Churchill, which says, "Never let a good crisis go to waste." So there's a lot of lesson to learn here from a real estate point of view. And I think one of the big drivers from a strategy point of view is that business has been given a chance to review their work strategy, their work from home. And I think from a real estate point of view, this is going to have an impact on how space is used. From a social distancing or spatial separation point of view, but also from a work from home point of view. Businesses are finding that staff or employees are actually working better. Their results are better from working from home. So they probably will come back to you and say, well, I actually want to relinquish some of my space, or I want to redesign my space, which I think is going to have a big impact in terms of planning of our premises in the short term, but also in the need of additional space in the long term. Okay, just from a strategic point of view, I think it's important that we keep that in mind. We already getting exercise to do restacking of our buildings to maximize utilization, taking into account spatial separation as becoming maybe a norm, and but also the ability to be prudent in the way we use the space going forward. So in terms of office desk and clusters, I think Andrew did allude to the 1.5 meter to 1.8 to 2 meters, different depending on which measurements you're going to in term clusters. John, I'm just going to share my screen just to show.
Thank you.
If you don't mind, just to show a quick slide.
All right, we're picking that up. Yes, I've got it.
I'm not seeing it, but you guys are seeing it. Is everybody seeing my slide?
I can see it.
No, not everybody. Cliff, Andrew, you're not seeing it.
Yes, I can see it, and I see quite a few chat messages coming through from attendees that they can see it.
Okay, so basically it shows a typical cluster layout of six desks in a cluster, and then you can see the way we've looked at is the circle shows the 1.5 meter radius between clusters, and then no one opposite. So if we take the yellow block, you'll have a staggered approach with no one-to-one cluster. This again, it will have to be a change according to your environment, but this is just a generic view of what can be done and the way we've done it in our organization. And we've labeled also all these desks with a green sticker, also as a visual reinforcement to show people where they can sit and where they cannot sit. And that's from a cluster and offices as well. We're going to go on a one-to-one basis for offices to ensure there's enough spatial distancing. I'm going to stop sharing, John, so it should go back to your slide. So in terms of offices, I think it's logical to keep it to one person per office. And office clusters, which is mainly the norm, is to keep that staggered approach. Again, the prudent thing is not to do too many relocation, rather move people and equipment if it's possible. But in some cases, you might have to reshuffle your environment. Bearing in mind, you'll probably have to do a deep clean once after that has happened, just to ensure safety of the people coming into the new environment. Moving on to meeting rooms and training rooms. Similarly, you still have to keep that spatial distancing. Again, if you have what's one of the solutions that have come through, you have a 20 people meeting room, and you have you will probably go on to 50% of that, keeping those distances. So you'll have 10 people in one room. Then using technology, you could still have people attending the same meeting, but in 2 separate rooms. So they're going through a Zoom session or team session, but meeting in 2 separate rooms in your organization or at various spaces in the building to make those meetings viable. It could be in a building, or they could be joining from home. or from various other locations within your premises, which helps with the spatial separation. Training room, we also, on the same similar basis, you probably will halve the location of training room, or the capacity of training rooms, bearing in mind that at this point, it could be not at this level 4, there is no gathering as such, although it speaks mainly of external gathering. So internal, we could base it on a similar basis as your office space. But I would be very cautious to have training sessions in training room unless you could do it virtually, or you provide a spatial separation in those training rooms. Agile spaces, moving on to agile spaces, there's various types of agile spaces. The ones which are the small enclosed spaces where 4 people can sit, the shared table, the collaborative spaces, I think those will have to be out of bound, because you will not be able to maintain your spatial or social distancing. It is important then to close those off, make them unavailable. Good ideas is to use danger tape just to not make them available, or again to use some type of signage to say that those spaces are not available at this point. In the ones which would...
David, 2 minutes.
Okay, the other ones that are interesting, you could go for the one-to-one basis, which still can be used. Canteen, staff restaurant, Andrew did speak a bit on that, is about limiting the amount of people going into the space. At a level 4, there will be no sitting capacity available. So working with your providers in terms of providing takeaway meals, limiting the access, ensuring that the staff serving have got the relevant PPE, constant cleaning of the devices that people use, the pay point especially. There's different criteria for the staff restaurant back of house, ensuring that this level of hygiene is maintained. And once visitors and people can come back into to maybe a level 3 or a level 2, is still keeping spatial distancing at the tables, again using a label type of scenario. Retail shops, if you have some in your premises, is ensuring that they in turn follow the regulations of spacing, putting markers on the floor, limiting the number of people in the shop itself, and managing the cleanliness of that. I'm rushing a little bit just to try to keep to your time, John.
Thank you.
The last one is auditorium, events, and gathering. Again, that should only come into play at a level 2. Once you have some type of visitors coming in after they have been screened, through temperature checks and all of that, you would be able to do some type of events and using your auditoriums or your gathering place. Again, limiting the numbers, probably to 25, or depending on the size of your rooms. So in general, I think there's quite a lot of work to be done there, and to work with business in terms of ensuring that they understand to work their shifts into the office space as well, and working with them so that you can prepare the office environment to suit their operational need. Okay, John, I'm going to
Thanks very much, David. Right, before we, this is about halfway, before we start the next speaker, just to let everyone know, we're launching a poll. It'll be launched now or shortly, in which there are a number of questions. In fact, there you are, it's just been launched. And we would like the input backwards to us, feedback to us on the questions that we, from everyone that's taking part in this. So if you can all come back on that, and then we'll collate the answers and then share those. Right, the next speaker. So the next speaker is Stephen Malloy, talking on Soft FM. and then we're getting down to, and then after that we will have Cliff talking on hard FM. So Stephen, 10 minutes from you, please, on soft FM.
Thank you, John. Yes, I'll be talking more on cleaning and on bathroom and toilet changes that are looking at. The pause areas and catering has been covered by David and the previous speaker as well, Andrew. So I'll focus on the first two. If you can put on the next slide, please, John. So that's a pictorial of a typical work environment. This is like a pause area, and from you can see a figurine there, a dog figurine with the letters A, B, C, and D. So I'm going to talk from a cleaning perspective. So we will focus on the contact points, which is the A is the person carrying the virus. B is some of the water vapor carrying the virus that comes out of people's mouths when they talk or when they cough. C is a contact point where the staff might be touching areas, and there they're touching the sink at the pause area and the cupboards you can see behind it. And then on the left-hand side, you'll see D, which is, it could be your area of eating, a catering spot, or it could be your desk where the virus is then transmitted. So we're going to talk about the areas in terms of the cleaning and on the cleaning of surfaces, more likely. And so what I'm going to start with is very basic methods that have been recommended by the American Society on the COVID epidemic affecting America. We'll pass the references through after the talk. So the first item is the increase in points C, contact areas, D, where people sit, the increase in cleaning. Now this you're looking at all your types of handles, handrails, telephones, computers, glass surfaces, taps and counters, and there's a specific method we need to look at. Before we even look at sanitizing these surfaces, we need to look at the dirt on top of the surfaces. The societies call it the biofilm, because before we can actually remove the viruses of the workplace, we must remove the dirt, which is called the biofilm. The biofilm actually protects the viruses, and it prevents the sanitizing sprays or sanitizing wipes from working properly. So in terms of the cleaning regimen, we're looking at the most optimum is to clean the surface thoroughly. And in terms of time, we can look at either every shift for your staff, or on a highly used area, you can even look at every 1 hour to every 4 hours, like for pause areas like we showed in this diagram. So first is to clean off the dirt, the biofilm. And the next part is to put on your sanitizer. Now the sanitizer is recommended by SAFMA in a previous email. It contains either 10% bleach or 62 to 71% ethanol-based cleaner. That is a part of the sanitizing on your surfaces that will kill the bacteria and the virus. And it's important that only after cleaning your sanitizers are applied. And then the sanitizer itself has to have a dwell time on the surface. So typically for the sanitizers that I just mentioned, the one that bleach or the ethanol based, you look at a dwell time on your surface of between 30 seconds and 10 minutes. So once you put your sanitizer on, you mustn't carry on wiping with another cloth. It will just remove the sanitizer from your surfaces, and then the process won't be as effective. Another point is if you're using a cloth to clean prior to sanitizing, that cloth has to be sterilized and cleaned quite often, because otherwise one just spreads the viruses and the bacteria from one surface to the next. So that's the one important point. Let me just move on. Yes, so as I said, in terms of cleaning regimen, we can look at increasing this even up to hourly in facilities like airports and sanitizing, or maybe every 4 hours in your business in the high traffic zones like your pause areas. And at least every shift or every end of business and start of business as a minimum. Where your spaces and equipment are shared, like as I said, your canteen and pause areas, this is where your cleaning regimens have to be more often. And then for personal computers, personal telephones, perhaps every shift change or at least once a day, that is what we're recommending. With these new measures, you will need to have both an increase in staff, cleaning staff, and of course, there will be associated increases in cleaning chemicals as well. The second part we need to just touch on is some recommended changes to your toilet and bathrooms. As you heard from the minister yesterday, your normal towels in your bathrooms is no longer acceptable because it just spreads your germs from one person to the next. So here, from SAFMA's side, we look at paper hand towels, which is the optimum, and even hot air hand dryers could be a problem due to the transmission via air of the virus. So it just blows hot air and blows the virus around the toilet areas. And the other item is your handles. Here you see on the picture the handle of the tap at the basin, and then in the toilets, the handles there as well. There we could look at, for the future, some of the disabled taps where you don't have to use your hand to touch everything to open and close the taps or faucets. You're more your medical or disabled types there. Okay, the last area I wanted to speak on was the catering and areas, and I think it was covered by the previous speakers. Other than to say that the cleaning regimens in those areas need to be increased with having normal cleaning plus your sanitizing of your areas depending on the amount of people taking place. Okay, thanks, John. That's all from my side.
Thank you very much, Stephen. I think what you picked up on there for the cleaning is a big change. We're looking at more staff. If you look at the cleaning regime, the training of the staff is going to be critical. You're looking at different and more chemicals. So the whole cleaning regime, it's not just someone coming in with a mop and a cloth and wiping it down anymore. We've moved into cleaning being a really professional service with properly trained staff. I think what you've put out there has just changed radically the nature of cleaning for a lot. I'm not saying for everyone, but certainly for a lot. Thanks for that. So the next speaker is Cliff. He's going to talk on hard facilities management. Cliff, over to you.
Thanks, John, and thank you to Andrew, David, and Stephen for the topics covered to date. Some really interesting stuff coming out there. No less interesting, however, than our typical facility services, our typical nuts and bolts that make our facilities operate. So let's start off with the most controversial of these topics, and that's our heating, ventilation, and air conditioning. Now, as we all well know, HVAC or air conditioning systems have over the years been blamed for a lot of issues in buildings. If we go right back to the early days of Legionnaire's disease, our air conditioning was deemed to be the catalyst of those issues. If we go to sick building syndromes, the HVAC was the guilty party. And of course, there are schools of thought around the world now that state that our HVAC, contrary to earlier belief, our HVAC systems can be intimately involved in the transmission of the COVID-19 issues. The school of thought talks about the traditional or perceived or recognized, rather than perceived, recognized method of this virus being spread around through sneezing and huge particles or droplets being spread via surfaces and the like that we've just heard of. But there are a number of schools of thought around the world now that say that these huge droplets now get broken down into small droplets, and these can be transmitted via our air conditioning systems. There's a stated case of a restaurant in China where there were 8 or 9 guys seated within the prescribed 2 meters which they put in place in China. They were all compliant, and everyone present in that restaurant picked up the virus over the next, or showed symptoms of the virus over the next week or 2. And the only deduction that anybody could come to was that it had been spread via the air conditioning system in that restaurant, which had sort of gone in the face of everything that had been described up until that point in time. So while this controversy is floating around, we as facilities managers have got to be mindful of the fact, and we've got to be aware. We've got to put issues or steps in place that ensure that our air conditioning and our air ducting and so on is not going to be responsible for spreading this virus at a rapid rate, which is obviously not what we want. The way around that, how do we go about treating this? How do we go about modifying or enhancing our air conditioning systems? I don't think there's any one size fits all here. I mean, we are well aware, or we have been made well aware, that this virus doesn't like heat. So fortunately, we're going into the colder weather. We're going to have to warm up our offices instead of cooling them down. So maybe a little bit of temperature via our HVAC might do the trick. We could also obviously look at increased filtering. Of course, when talking filtering, the first step is to ensure that our filters are continuously kept clean, not so. That's going to, I think, be the basis. But I think the message we have to get across is that we need to be aware that this virus is going to be more and more airborne than was first perceived. We need to also bear in mind that we need to enhance and ensure that our HVAC systems are maintained, are kept up to the maximum performance levels so that they can do what they are meant to do. I'm sure we can put together a thesis of questions around the role of HVAC in the control and the stopping of the spreading of this virus. But I'm sure time will teach us, and time will help us ensure that we can do the necessary things that need to be done to our HVAC systems. The next important aspect in terms of building fit outs and so on is the use of biometrics. And of course, the impact of this pandemic is, in the view of a lot of experts, going to change the landscape of the biometric industry, but totally. And the big point that comes through from a logical perspective, and not taking technology into account, but from a logical perspective, is that the need for touchless access control and workforce management biometric systems is going to be on the increase, obviously. Because every time we place a finger on a pad of any description, you are exposing some sort of risk there. So touchless fingerprint, palm print, and vascular recognition is obviously going to be the order of the day. Face recognition, DNA, pupil recognition, whichever one is going to work for us is where we need to start going. Of course, we're going to come up against the hardy annual, but what about the cost? So we've got to be mindful of that. If we are going to be left with the touch pads and the touch screens and so forth, we've got to take into account what was said by Stephen and ensure proper sanitization there in order to make our touching of these bits and pieces as sterile as is possible. So as we say, biometrics is going to be a changing environment, going to be a changing world. What about our escalators and elevators? What do we do when we get onto an escalator? The first step is to grab onto the rail and proven as one of the most unhygienic places in any workspace or any public space as well. So we've got to be mindful of that. Of course, our cleaning colleagues will ensure that these things are kept as clean as is humanly possible. But you know, to fly in the face of our health and safety experts, grabbing onto things generally is not going to be a good idea. But our escalators, our lift systems create huge challenges. I mean, what do we do when we enter a building? We have a crowd of people coming to work at a fixed time, and you need to get as many as is acceptable into that lift to get to the floor that you need to travel to. Well, that's going to change, isn't it? Because our 1.5 meters is going to change that for us. So instead of 8 or 10 people in a lift car, we're going to have 3 or 4. We're going to have some sort of queuing taking place at our lift lobbies. So these are all going to be issues that are going to impact on us. What about normal hard surfaces, normal hard issues in our workplace, our door handles? Things that we need to interact with in order to gain access. I think there is a case of being mindful, being aware, and as we are doing at the moment, regular washing of our hands, regular precautionary measures through the use of sanitizers and so forth is the order of the day, no matter what equipment it is that we are dealing with. And of course, for our facilities managers who are touching and feeling bits and pieces of equipment all day and every day, I think it's absolutely essential that those basics are adhered to. Thanks, John. Thanks, guys. Been a useful discussion.
Thank you very much, Cliff. I think that looking forward, I think there's 2 topics that we will need to look at as webinars. One will be HVAC as a topic on its own for a webinar. What we're going to do, we 100% fresh air churn, what that does to electricity costs. And the other is how you secure the building in a touchless environment. Biometrics out. I mean, they ask you to sign in, and then they give you a pen. Well, now everyone carries their own pen, but I mean, I think there are a couple of topics that you've raised there, Cliff, which will be certainly subject for future webinars. Thank you. So now we are going
definitely the HVAC one. The HVAC one is loaded with controversy.
Yes.
Yeah.
So I think that it is loaded. I think also anything you do on that is going to be money, big money, and people will want to spend it the right way. So I think that I think there's opportunity for a topic discussion there. So I've got two topics marked down out of yours. One is HVAC and the other is security. And I think that coming out of Stevens as well is cleaning and staff training and staff levels. But training is we've just moved the whole goalposts on training of staff. So picking up a casual cleaner on the street and putting them in a uniform and letting them loose in a building, that's just stopped, which is also going to place challenges. Right, let me see. We've got where we pick up the questions. So I've got one here, which is what are the risks of wearing a cloth mask with no filter for an extended period that is inhaling CO2? Well, we don't have any medical people. I don't know whether any of the panel have a view on the extended on use of a cloth mask for an extended period, and whether it is going to impact that. Cliff, David? Well, then we'll have, I guess that one we'll have to take away and see if we can come up with a...
John, I would just say that, I mean, I watch a lot of the briefings from the UK and from the US, and not even the scientists can agree on what the risks associated with mask wearing is. So I don't think that's necessarily a question that us mere facilities managers can answer, rather.
And I think also, just to add on to that, is also depends on your mask that you have. Is it a 3-layer mask? Is it a single layer mask? What type of fabric is used? So I agree with Andrew. I think this is out of our realm.
Yeah, for once.
Okay, I think if I look at the questions, there are a number on HVAC that have come through. So I think that is a topic that we'll pick up. We'll get some HVAC engineers and a panel of HVAC people to actually come in and go through that with us. And I think that cleaning is another one that. So I think looking forward, there's 3. Cleaning would be one, HVAC definitely, and then security. Okay, so those are the messages I've got coming through. In terms of the environment, the landscape area also needs to be discussed regarding the lockdown period and infestation of vermin. Well, that's a good question. I think there's quite a lot of pictures circulating on the social media around the world of nature taking back the urban space. I've seen kudu running around Silver Lakes, and a lot of us have seen lions on Skukuza, but that's not unusual. Skukuza golf course, that is, but leopards in parts of Pretoria. But certainly with people not being around, what the impact is on pests and pest control. Anyone on that, Andrew?
Yeah, John, I think one of the things, two different, the question is sort of two-pronged. Obviously, we've seen some reclaiming of the landscaped areas. An interesting study I saw, again from the UK, was that bird sound apparently is much louder now because it doesn't have to compete with the traffic. But in terms of vermin and pest infestation in our facilities, that was an essential service. So I haven't seen too many issues around the infestation of vermin, but obviously some workplaces have been closed up and you might get some surprises when you get back. But certainly pest control was an essential service.
Yeah.
Okay.
Just
And then,
on that, John, I got a call yesterday from somebody that opened their offices for the first time since the end of March, and they were horrified to find a little bit of a rat infestation in their facility.
well, I would think that that a number of people going back to offices, never mind rats, but certainly the creepy crawlies, mites, and cockroaches and that sort of thing could be more. There could be more than there had been in the past because they've come out of hiding. So certainly, I think that could be expected. Right, one question: what measures have been put in place for extra screen protection on desks? That is sneeze screens type arrangements. I think some of the retailers have got them up, but the question is, how can we handle that in the workplace? David, or have you got anything on that?
I can add, so again, it depends on your layout and your interactions. As you saw in my sketch, it was staggered, so there's actually nobody in front of that person. But as you gear up and more people come to work, it might be a requirement. And it's at this point, from a regulation point of view, it's not specified, but it's voluntary, and it's one of the tools that you can use to help in terms of mitigating the spread. So it all depends on your circumstances. But I think in terms of front-facing, customer-facing, that's a definite need. In terms of workspace, because one of the things that that's been also regulated is that everybody must wear a mask at the workspace on a continuous basis. Not just when you're walking, not just when you're talking on the phone. You have to wear it everywhere, which helps. But I think from a customer front facing, if you're doing those interaction, I would definitely put those in place, which could be reception as well.
John, if I can just come in there, the regulations that were posted last night definitely call for PPE in public-facing positions, which obviously a receptionist is. So, I mean, a sneeze screen is probably preferable to just a mask, but I wouldn't rely on the sneeze screen as well as, I wouldn't rely solely on the sneeze screen. A mask is required, but I would put a sneeze screen in as well. And to try and maintain that 2 meter distance. That's often difficult in a receptionist because you know when you walk up to a receptionist desk, you're probably within half a meter of that person. So you need to have a line on the floor that says, you know, please don't go beyond this line, like you have at the airports, and that needs to be controlled. Very importantly, the regulations say it has to be controlled. You can have a designated person that's responsible and maintenance, but you have to control as well. That means that you physically have to tell people, if they step over the line, please move back.
Okay, that brings us, I think, to, sorry?
Use of ropes or belts just to filter people through so that it's an organized, not just everybody rushing. Also the limitation, remember you're also going to screen your visitors as they come in as well. So, and visitors will only be allowed to come in at, I think, level 2 to be able, limited numbers of visitors after a screening process. But the rope filtering and managing people at any spaces will be required.
Okay, that I think brings us to the end of this webinar. Thank you to our panelists, Andrew. Thank you, David, Stephen, and Cliff. Thanks very much. This one will be repeated next week. And I think that we've picked up some topics already, which will go into the webinars 5, 6, and 7. So, and we'll pick up on questions that come in, and we will respond to the dynamics of the marketplace and COVID-19 as we move forward. So July 19 might have its own set of topics, which we'll get there. So thank you very much. and we look forward to everyone staying safe and joining us at the next webinar. Thank you.